In this video, we'll discuss everything about low blood pressure, as well as the possible causes, symptoms, and treatments. Hi there, it's Dr. Richard, and I'm a family medicine consultant physician with over 20 years of medical practice. Welcome to LU Health's channel. Today, we're diving into a comprehensive guide on low blood pressure. Yes, you heard me correctly, low blood pressure, not high. A topic that affects many millions of people, but doesn't always get the spotlight it deserves, especially for the most commonly affected group, females aged 20 to 60 years old. We'll cover everything from symptoms and definitions to long-term effects. Whether you're experiencing symptoms yourself, researching for a loved one, or just curious, stay tuned and get all the information you need. If you stick around to the end, I will also provide you with my top tips for self-care, as well as what could be some points of possible medical options. Please note that this is for general information purposes only, and if you need a diagnosis or consultation, see your medical professional. So let's get started. What is the definition of low blood pressure? Okay, so while high blood pressure gets a lot of attention with healthcare professionals and patients alike, it is on the whole a symptomless or silent problem, whereas low blood pressure can be much more problematic with more obvious symptoms, as you will see. So what exactly is low blood pressure, or as we say, low BP? Medically, it's defined as a blood pressure reading lower than 90/60 millimeters of mercury in an adult patient. Just so we're clear, normal blood pressure has a defined optimal range between 90/60 to 120/80 millimeters of mercury. A low BP below 90/60 could ultimately lead to insufficient blood flow to your organs, resulting in decreased oxygen supply to those organs, especially the brain, causing various short-term and long-term health issues. And so in severe situations, the human body has developed emergency mechanisms to try and stop this happening, leading to some of the common symptoms such as fainting. While this is outside the scope of the video, I want you to know that the first number in the BP reading is called the systolic pressure, and the second number in the reading is the diastolic pressure. They are both important. Now let me know in the comments below if you want a more detailed video on systolic and diastolic pressure readings, their meaning, and how us doctors would view and evaluate them. So how do you measure your blood pressure? Measuring blood pressure accurately is really crucial. Using a sphygmanometer at home will normally mean using an automated digital machine. Now saying sphygmanometer is tough. I struggle, as do most people, with this, as it is a bit of a tongue twister. Let's call it the BP machine. Ensure you're seated comfortably with your arm resting at heart level, and avoid any caffeine or exercise for about 13 minutes before you. Also, don't cross your legs and sit up straight, or ideally at 45 degrees. Think of how your mum tells you to sit at the dining table. That's how you need to be. Sometimes when you're having the symptoms of low blood pressure, take your blood pressure at that time so you can see how low it is going down to. Then regular monitoring can help you and your doctor track the changes and understand your condition better, looking for things like patterns, the time of day, or any activities that provoke your symptoms. I suggest taking your blood pressure at least 5 times a week, if not daily, but there are many ways to record this down. If you want to go old school, it's obviously pen and paper. Otherwise, there are some good technologies that can help you do this. Do let me know in the comments below if you want any recommendations on different apps and technologies that will help. Let's talk about the symptoms of low BP, technically known as hypotension. Just so you know, high blood pressure is known as hypertension. Many of my patients come to me with the common symptoms of low blood pressure, but they don't know why they're having them and what to do about them. So let's talk about some of these more common symptoms. So first one is dizziness. So this often happens when you get up too quickly, but also can occur other times, like just sitting watching TV. Secondly, we might look at something like fainting or almost fainting. This will sometimes coincide with those dizzy spells, or could happen out the blue for no obvious reason. Just be careful, please, that you don't fall or collapse on the floor. Blurred vision, seeing stars, hazy images, tunnel vision, even vision going black for a split second can occur with sudden movements. Another one might be fatigue, that you can feel tired all of a sudden as if you just ran for an hour, or it might just be that feeling of constant weakness. Something else like nausea, where it can happen related to the previous symptoms mentioned, and it can even lead to vomiting in severe cases. Next would be something like lack of concentration. If you're constantly mentally drifting, suddenly realizing you've zoned out and your productivity is dropping, it can be a symptom of low BP. Another one is having cold, clammy skin. And this too is often associated with fainting or almost fainting. So these symptoms can be concerning and affect your daily life. They can be mildly annoying to severe and debilitating. But if you're experiencing any of these, it's essential you understand the possible underlying causes and seek qualified help. I would certainly suggest going to see a doctor as soon as possible. There are three main physiological impacts of low blood pressure which lead to people with low BP to have symptoms. So number one would be reduced blood flow to the organs. Now, low blood pressure can limit the amount of oxygen and nutrients reaching your vital organs, leading to symptoms like dizziness and fatigue. Did you know your kidneys receive about 20% of your blood volume flow at any given time? And this high demand for blood flow is essential for filtering your waste and balancing your fluids, which is why reduced blood pressure can significantly affect kidney function and therefore overall health. Secondly, inadequate blood supply to the brain. When the blood pressure drops, the brain may not receive enough blood, causing the symptoms such as poor concentration, blurred vision, confusion, and leading to nausea. Did you know that fainting is just the human body's way of getting you to be flat on the ground so your head is level with your heart, and what blood flow there is to the brain is not having to be pushed upwards against gravity? The body is an amazing machine and knows exactly what it needs. Thirdly, the heart rate changes. Now, your heart may beat faster to compensate for your low blood pressure, which can sometimes result in tachycardia, which is very fast heartbeats, or palpitations where it's jumping all over the place. Did you know, for instance, that the release of adrenaline, a hormone your body produces in response to stress or low blood pressure, can significantly increase your heart rate? This fight or flight response is your body's way of trying to quickly restore your blood flow and maintain your vital functions. Let's not forget though that there are also psychological impacts of low beat. Things like anxiety. The unpredictability of the symptoms like dizziness and fainting can really lead to stress and anxiety and fear about when the next episode might occur. This will really affect you, how you deal with your day and how you deal with your loved ones. Secondly, stress. So managing symptoms can add to your daily stress, especially if you're balancing work and family responsibilities. You can find yourself getting short-tempered or moody, interactions with your co-workers, friends and family, which will lead to tensions and misunderstandings. Thirdly, overall, you'll have a reduced quality of life because these persistent symptoms can lower your overall quality of life, making it harder to enjoy activities and maintaining your productivity. You'll notice some people with low blood pressure saying no to a lot of activities or even taking vacations, etc. So causes of temporary hypotension are things like orthostatic hypotension. This is when you stand up too quickly and it can cause a sudden drop in blood pressure. This leads to the dizziness or fainting. If you have this, just be careful when you're getting up. Dehydration is a big problem. When your body loses more water than it takes in, the blood volume will decrease, and this will lead to lower blood pressure. So water is vital in maintaining your body hydration and also your blood pressure. Then there's things like acute blood loss. So sudden loss of blood from any injury or you've had some surgery. It can also quickly decrease your blood volume and therefore temporarily lower your blood pressure. In this case, I obviously suggest immediate intervention from your doctor or an emergency care team. Things like sudden heart problems, events like that are obvious like a heart attack, but things like sudden heart failure can cause a temporary drop in blood pressure. So don't tinker with your ticker. Severe infection is another one. Any infection that gets severe in the body can lead to dangerously low blood pressure. So you want to make sure you don't go into septic shock from any infection that gets into your blood. Now this is rare, but it should really be taken very seriously. So then there are the lifestyle factors which affect your blood pressure and can cause temporary low BP. Things like dietary changes. So if you have a poor diet or you suddenly change your diet, can really affect your blood pressure. You need to make sure you have a healthy level of protein, and sometimes if you go to a very low protein diet, you actually lower your blood pressure more than you intended to do. So the same applies for physical activity. Lack of physical activity or the opposite, excessive exercise, can both influence blood pressure. I read this and I'm sure you're thinking what I am. How does this make sense? Well, in fact it does, because you need to maintain healthy levels of physical activity, but you don't want to overdo it constantly. Next would be weight loss. Now, if you have massive weight loss, especially over a short period of time, this can reduce your blood pressure significantly. This is especially true if you're going on some of the weight loss medications or you've had any weight loss surgery. So next I would want to talk about the more permanent issues that cause chronic hypotension. We'll start with things like heart problems. Long-term heart conditions like bradycardia, which is slow heartbeat, or heart valve problems, or even heart failure can lead to a chronic low blood pressure. Again, be careful how you tinker with your ticker. Next on the list would include endocrine issues. Now, these are disorders like Addison's disease, low blood sugar, or thyroid problems. They can all cause persistent low blood pressure. In fact, many women with thyroid problems end up with being hypotensive. And if not properly diagnosed, normal readings of 120/80 would be high for them. This is why it's important to track your own personal BP. Now, medications and supplements, they also can cause more chronic low blood pressure. Certain medications such as diuretics, beta blockers, and some antidepressants can lower your blood pressure. Usually if you're on the blood pressure medications to help you lower your blood pressure and then you lose weight, you may need to lower your dosage as with direction from your doctor. If you're on other type of medications, please make sure to check the side effects with your doctor, as it's important to understand why the onset of low PP has occurred. Other things such as supplements. Some dietary supplements might also affect blood pressure. Now, supplements are not strictly regulated as medical interventions and pharmaceuticals. Now, I'm not trying to be controversial, but when you take a supplement, please do your research in advance. Some are perfectly normal and safe, others might have side effects for you and for your loved ones. Treat them as you would any medications and do your homework. So, next we'll move on to what are the investigations for the causes of low blood pressure. To understand the causes of low blood pressure, doctors might run several tests, including blood tests, ECG, echocardiogram, or things like a tilt table test. These investigations help pinpoint the exact cause and then they guide appropriate treatment. So let's go over them in some detail. So blood tests. Now, doctors can run various blood tests, usually around things like your red and white blood cells, your hemoglobin, your platelets, and these detected conditions like anemia or infections that can cause low blood pressure. We would also check things like electrolyte levels, so imbalances in your sodium and potassium and other electrolytes. It's also not unusual to check your thyroid function test to evaluate the thyroid hormone levels. Other types of investigations doctors will usually run are things like electrocardiogram or an ECG or EKG in the States. These are for heart rhythm analysis, and they record the electrical activity of your heart to detect any irregularities, any arrhythmias, or other cardiac issues. It also identifies signs of a previous or ongoing heart attack, and that obviously can result in low blood pressure. An echocardiogram, which uses ultrasound wave to create images of the heart, allowing us doctors to assess the heart structure, the pumping efficiency, and the valve function. You may know this as an echo. It is also used to look at the heart muscle structure, which helps detect conditions like heart failure and cardiomyopathy or valve problems. The last one would be the use of a tilt table test. Now, this measures how the body responds to changes in its position. During the test, the patient is strapped to a table, and that tilts from horizontal to vertical position. It sounds quite inhumane, and it's not pleasant, but it is crucial. Now, blood pressure and heart rate are monitored, so it sees how the body reacts. There are some additional tests that might include things like a Holter monitor, which is a 24-hour ECG, and autonomic reflex testing. Let me know in the comments below if you'd like to know any more detail about these tests. Now, let's talk treatment. After identifying the underlying cause of low blood pressure, we would then go on to look at how we best manage or treat the problem. Managing low blood pressure often involves both self-care and medical treatment. Here are my top 6 tips to help you manage your low blood pressure. Number 1, stay hydrated. Drink plenty of fluids, especially water. As mentioned before, dehydration can really cause blood pressure to drop. Number 2, eat small, frequent meals, as large meals can sometimes lead to a sudden drop in blood pressure. Therefore, smaller, more frequent meals help maintain a more stable blood pressure. Number 3, this sounds odd, but increase your salt intake. Unlike high blood pressure, those people who suffer with low blood pressure might benefit from a bit more sodium salt in their diet, but always consult your doctor before making these changes. Number 4 is wear compression stockings. They're not sexy or attractive, but they really can help your blood flow and reduce your symptoms. Number 5, this is an obvious one, but avoid rapid position changes. When you're standing up, do it slowly, especially from sitting or lying down, and this is to help you avoid that dizziness or even worst case, fainting episodes. Lastly, number 6 is medication. In some cases, doctors may prescribe medications to help raise your blood pressure. These can include fludrocortisone, which helps increase blood volume, or something called midodrine, which helps tighten the blood vessels. But remember, always consult your doctor to see if this medication is the right one for you. So what are the long-term effects of low blood pressure and why should we be bothered? Well, untreated low blood pressure can lead to complications like falling over due to fainting, and this obviously could lead to traumatic injuries like to the head or the chest. Also, untreated low blood pressure can sometimes lead to cardiogenic shock or damage to the heart and brain. So it's crucial to manage the condition and avoid these long-term effects. Now, regular checkups and following your doctor's advice can help prevent these complications. Obviously, living with low blood pressure can also have the psychological effects as mentioned before, including anxiety and stress about the health condition. Addressing these mental health aspects is important for overall well-being. So you might want to consider mindfulness practices, speaking with a therapist, or joining a support group to help you manage the psychological impact. And don't worry, it's not as uncommon as you think. There are a lot of people in the same boat as you. The benefits of managing low blood pressure go beyond just availing the symptoms. By maintaining a healthy blood pressure, you are also promoting better overall cardiovascular health, reducing the risk of your heart disease and improving your quality of life. Now, for women between the ages of 20 and 60, the main group this affects, this means more energy to pursue your passions, spend quality time with your family, and excel in your chosen careers. The benefits of treating low blood pressure can significantly improve your quality of life. It reduces the risk of complications, improves your energy levels, and enhances your overall health. Don't ignore the science. Take action and consult your healthcare provider. I've also listed a few resources you may want to check out in the description below, and this will get you started. This list is not exhaustive, but does give you a decent starting point. Remember, taking proactive steps today can lead to a healthier and more comfortable tomorrow. Thank you for watching and listening to our comprehensive guide to low blood pressure. If you found this video helpful, please give it a thumbs up and share it with others. Don't forget to subscribe for more health and wellness tips and information, and we'll see you in the next video.